That's what I wanted to ask the court. Dr. Wu is available.
Court is in session.
Dr.
But he's
Wu
not been deposed yet.
Wait, we're almost finished with it.
Well, but you're not done.
Halfway through Wu's opinion, he was very succinct and quick, but we spent the whole lunchtime with him, and I just need about another 15 minutes with him, and then I would need to talk to the prison expert.
My intent is to call, my first intent was to call Mr. Land because of scheduling issues, but apparently he's testifying in another case right now in the courthouse.
Okay.
So my intent is to call Dr. Eisenstein. I think that'll take probably an hour and a half total, is my estimate.
And then we could probably take hopefully Land is done. What's he testifying in? I'm just curious what type of case is it?
He's testifying in now?
Yeah.
Deborah Goins. So all I know is Deborah Goins is the defense attorney. But I don't know
Miller
what I
resentencing.
guess it's the
She
30th.
does a lot of Miller resentencing. Is it 30th?
I don't know.
Maybe a Miller resentencing.
Okay.
All I know is that he's testifying for Deborah Goins.
But well, he should be available by mid-afternoon.
That's my understanding.
Okay. And so then how long do you anticipate his testimony taking?
15 minutes.
Okay. So what we'll probably do is take a break after Eisenstein, and then hopefully Land's done, and then you can speak to him over the break, and then we can proceed forward with his testimony.
That's fine. This afternoon, we're going to break for the defendant to be examined by Dr. Lazaro.
At 4.
At 4. I told Mr. Hernandez if Mr. Brunman can sit in for him while I finish with Dr. Wu, that would be helpful. Dr. Wu indicated he has 3 reports that I wasn't aware of, but he indicates they have been sent to Dr. Holder. I have no reason to not believe that he was my rebuttal expert. So, but I still need, he's going to forward those to me by email this afternoon. I need to get them, and I need to get them to Dr. Lazaro.
Okay.
That was sent to Holder at the beginning of the trial. But, Judge, I was informed this a few minutes ago that the state has a rebuttal witness by the name of Georgette Redley, who apparently would testify, a Jamaican lady that would testify regarding the video. I don't know if we're starting at 9 or 9:30, but 9. So
she'll need to be here at 8:30 to talk to her.
That's fine. That's somebody who just came to our attention that we gave the video to review.
All right.
So.
Okay. Okay. So I'm going to bring in the jury. I'm going to discuss the schedule with them a little bit, but I think we're still on track to get the case to them sometime tomorrow afternoon.
Should I have Dr. Wu stay for the afternoon, or should he go back to his hotel?
What do you mean stay for the
Till
afternoon?
4 o'clock.
We're breaking at 4, so I'm thinking we're never going to get to Dr. Wu today.
No, I don't think we will. So, but he needs to be back at 4 to finish his deposition.
Correct.
So if he would like to not wait outside in the corridor, that's fine. Okay? Anything else?
Okay, good.
Okay.
And the PowerPoint.
Where is the examination going to take place?
I don't know.
Okay, I mean,
It's usually done somewhere depending on the bailiffs and the
usually done
courthouse.
at jail, but
Well, no, but he's,
We've seen them done at the
doctor's
courthouse.
here, we can do it here.
Yeah.
okay, and
Done at the courthouse.
we intend to videotape the examination.
That's fine. So then we can set it up here once everyone's cleared. Or if there's another place where we can set it up.
This is fine here.
Yeah.
It's
So
probably
once
better set
everyone
up here.
has cleared the courtroom, then you guys can set it up.
Very good.
Okay, you ready to go?
Yes, Your Honor.
Okay. Very well. Defendant is present for the record.
All right, you're entering.
All right, welcome back. Everyone have a seat. And I'm just going to talk a little bit about scheduling with you all. I just want to let you know that we are on track, I believe, to get this to the jury tomorrow afternoon sometime. So we're going to work to about 4 o'clock today, break for the evening, be back at 9 o'clock tomorrow morning, and I do think that at some point tomorrow afternoon, the jury will get the case for this phase of the trial. And I think one of the jurors had a question if I was going to be sequestering you over the weekend. I do not anticipate I'm going to be sequestering you over the weekend. Now, tomorrow because there will be deliberations that will begin on Friday. Again, I'm going to ask you to bring an overnight bag, just in the event the jury does not reach a verdict as to the sentence in this case before a reasonable workday is ended. But keep in mind that the deliberations in the penalty phase are going to be different from guilt. There are some initial findings that will have to be unanimous beyond a reasonable doubt. And if those findings are made, then it switches more to really the personal decision-making of each and every juror. So it'll be a bit of a different deliberative process. Okay? All right, very good. So with that, defense, call your next witness.
Defense would call Dr. Hyman Eisenstein.
Do you solemnly swear or affirm that the testimony you are about to give in this cause is the truth, the whole truth, and nothing but the truth, so help you God?
I affirm. Swear to.
All right, you may proceed.
Thank you, Your Honor. Sir, could you state your name and your occupation?
Give me 1 second. Dr. Hyman Eisenstein, clinical psychologist, neuropsychologist.
Dr. Eisenstein, at this point, if you could tell me what a neuropsychologist or clinical psychologist is. What is that?
A clinical psychologist is an individual that's licensed in the state of Florida. I have my PhD, my doctoral degree. Clinical neuropsychology is a subspecialty of clinical psychology. It's the study of human behavior, and neuropsychology specifically is the study of brain behavior functioning, how the brain functions, the cognitive abilities of an individual.
Now, if you could tell the jury, please, your educational background to get to the occupation that you have.
I have an undergraduate degree from Israel Torah Research Institute in Hebrew literature. I have a double master's from the Loyola University of Chicago in counseling psychology and administration and supervision and education. I obtained my PhD from the University of Health Sciences Chicago Medical School. It's now called the Rosalind Franklin Medical School. In 1982. I did both a pre- and a postdoctoral internship as far as my training is concerned.
Can you tell the jury about your internship training?
So my pre-doctoral internships, I spent 1 year at Fairfield Hills Hospital. It's a large state psychiatric hospital in Newtown, Connecticut. I did a postdoctoral internship at Yale University. It was the combined West Haven, Yale University epileptic seizure program for surgery, and that's why I did a postdoctoral internship in clinical neuropsychology.
Are you a licensed psychologist in the state of Florida?
Yes, I am.
And do you have any board certification?
I'm board certified from the American Board of Professional Neuropsychologists.
And where is your office located?
My office is located in Miami Beach, Florida.
And do you have any, in the course of your occupation, do you have hospital staff privileges anywhere?
Yes, I'm currently on staff at Mount Sinai Medical Center in Miami Beach, Florida.
And what professional organizations or associations are you a member of?
I'm a member of the American Psychological Association and the Brain Injury Association of Florida.
Can you tell the jury briefly your work experience since I think you said you graduated in 1982?
Correct.
Okay, can you tell the jury the type of work you do, your work experience?
So, upon obtaining my doctoral degree, I worked for 5 years at the same hospital that I did my internship, Fairfield Hills Hospital. It was a large state psychiatric hospital. I was on the forensic unit. That's where patients were found either incompetent to stand trial or they were not guilty by reason of insanity, a variety of different court issues, and they needed psychiatric treatment. So I was the psychologist for that unit for the duration of the 5 years that I was at the hospital. In 1986, we moved to Miami. For 1 year, I worked at Sunrise Rehabilitation Hospital as the head psychologist for the head trauma program. Stayed there 1 year, and then after that, I ventured off into private practice. Private practice consisted of having an office where I saw patients privately. I was a consultant to several hospitals at the time. I was a consultant at a neurology practice for several years, seeing head trauma, stroke patients, MS patients, typical patients that a neurology office would see, and I was doing the neuropsychological evaluations on those patients. Then I went off into private practice full-time and doing a variety of both forensic cases as well as head trauma cases from a variety of different sources.
Have you previously testified and rendered opinions as an expert in the field of neuropsychology?
Yes, I have.
And do you know how many times?
Well, probably, I don't keep tabs, but I've been doing this now for over 35 years, so probably, I would say 125, maybe, give or take, maybe more.
Your Honor, thank you. At this time, I would tender the witness as an expert in the field of neuropsychology.
Any questions?
No questions, Judge.
Okay, very good.
Now, Doctor, did you get involved in this case, the case of State of Florida versus Granville Ritchie?
Yes, I did.
And can you tell the jury for what purpose?
So I was asked to conduct a neuropsychological evaluation on Mr. Granville Ritchie. I spent several times interviewing and conducting neuropsychological tests. I conducted some interviews with some both family and non-family members, tried to read as much relevant collaborative materials that were available to form an opinion as to Mr. Granville's neuropsychological functioning.
These interviews that you had with Mr. Ritchie, where were they conducted?
So they all were conducted at the Falkenberg jail.
Okay. Can you tell the jury how many dates did you visit and interview Mr. Ritchie?
So I saw Mr. Ritchie over 8 separate dates.
And can you estimate the total amount of hours that you have spent with Mr. Ritchie in doing your analysis?
Approximately 32 hours.
Okay. Now, and do you see the defendant, Mr. Ritchie, in the courtroom today?
Yes, sitting in the corner.
In the corner, can you describe what he's wearing?
He's wearing a dark suit, a light-colored blue shirt, a red tie.
Your Honor, would the record reflect that the witness has identified the defendant?
The record should so reflect.
Okay. 32 hours. Can you break down what those hours were spent doing?
So in order to conduct a thorough evaluation, one needs to conduct a variety of neuropsychological measures, testing for IQ, memory, executive functioning. One also wants to look at validity measures to make sure that indeed the individual is genuine, giving his full effort. They're not trying to fake or look worse than they are. Of course, talking to him, conducting clinical interviews. So it was over 8 different dates over 2 years, and I saw him always at the Falkenberg jail.
Can you describe briefly the tests that you conducted in these 32 hours that you spent with Mr. Ritchie?
So the tests really fall into several different categories. IQ, memory, language, visual spatial, personality, functioning, attention concentration. There are a whole host of tests because, again, the purpose is to ascertain his functioning and not to rely on one single test, but multiple tests to see what's considered to be standard practice amongst neuropsychologists in terms of the final analysis of what issues or deficits or strengths the individual has.
And can you describe those tests, review them with us, but again, as in a brief manner?
Okay. So I gave him the Wechsler Adult Intelligence Scale, 4th edition. That's the gold standard of IQ. He obtained a full-scale IQ of 78, which is borderline, the 7th percentile of the general population. There is some variability in terms of breaking down the subtest. That is significant in terms of making a determination as to some cognitive impairment or dysregulation. I gave him achievement test. His scores were basically in the low average range except for comprehension, which was in the borderline range. That was a little lower. Probably the most significant findings were in executive functioning. Executive functioning deals with the frontal lobes, which is this part of the brain, and it deals with areas of judgment, reasoning, problem-solving skills, abstraction, the ability to shift sets, meaning one is as a certain predicament, a situation, whatever it is, that's what we're faced in life every single day, and to make a decision, the best decision possible in terms of processing the information and deciding what to do. On all the tests that I gave him, two specifically, Mr. Ritchie was in the severely impaired range. He had great difficulty understanding what was even asked for him. He was given information, different problem-solving skills, and he said he had no idea really what was being asked from him. Now, just to complement, to make sure that these results are really valid, I gave him several malingering measures. Now, malingering measures are measures to determine that the individual's putting forth full effort. They're honest in their work. They're not trying to look worse than they are. They're not trying to fake. That's something that's important in any neuropsychological examination because there's certainly a possibility for reasons to look worse than you are.
What test do you do to measure whether a person is malingering or faking?
So there's several. Actually, I gave 5 tests. 3 were direct malingering measures, and 2 also had malingering indices. I gave him one test, which was the TOM, the test of memory malingering. His score was fine. I gave him the word choice subtest. Again, his score was fine. And I gave him the structured inventory of malingered symptomatology, a third test. And his score was fine, meaning no indications of faking, malingering, lying, or being or trying to look worse than he is.
So when you are, based on those results, when you are conducting the other tests for intelligence or IQ or judgment, was there any indication that your testing was being compromised by any efforts to malinger?
No.
Okay. Now, you indicated, and I do want you to go through the test, but you indicated that Mr. Ritchie showed issues regarding the frontal lobe, correct?
Correct.
What does that mean to you as far as what could be the cause of that?
There are several different explanations as to what the frontal lobe impairment, the cause is. Mr. Ritchie has had several head traumas. He's had a few car accidents, a few injuries very young while he was still in Jamaica. So the combination of several different events that occurred, what we call is the synergistic effect. In other words, there was more than one incident of trauma to the brain, and the multiplication of all of those is certainly indication in terms of some type of injury that he suffered that could have resulted in frontal lobe impairment.
Now, is part of the time that you spend with him going through his childhood and incidents such as head trauma and things of that nature?
Yes.
So is that information, why do you obtain that information?
Again, one wants to see what pre-existed before I came to see and evaluate Mr. Ritchie. So the fact that he's at 10 years old, he was reported several already head injuries early on. And then, of course, there were several motor vehicle accidents later on in his life. But this is all prior to my actually evaluating Mr. Ritchie.
Now, in addition to talking to Mr. Ritchie, do you look at records or interview other people?
Yes. So
let's talk first about who else did you, in getting a history of Mr. Ritchie, besides talking to Mr. Ritchie, who else did you speak with?
So I spoke to his mother, Miss Gloria Gibson. I spoke to a family friend, Miss Antoinette Donaldson, and I spoke to his girlfriend, Miss Calicia Kelly.
Okay. Did they provide you information about the things you've described, such as the head injury, that was consistent with what Mr. Ritchie had given you?
Yes.
Okay. Did you also review any records?
Yes, I did.
Did you look at school records?
Yes, I did.
Did you look at police reports?
Yes.
Did you look at jail records?
Yes.
Did you look at other materials to get a full understanding of what the history of Mr. Ritchie was?
Yes, I did.
Okay. Now, did you also find out about the educational history of Mr. Ritchie?
Yes, I did.
You've indicated that he did not score well in IQ tests, correct?
Correct.
Tell the jury what you determined from his educational history.
So, Mr. Ritchie was held back in the 9th grade while he was in Jamaica. Now, this is from official transcripts. Up until that point, I did not receive any educational records, but we do have records from the 9th and the 10th grade. So he repeated the 9th grade, and he failed the 9th grade even the second time. and then he failed the 10th grade. The scoring system was from 100 was the highest, and it went down, of course, 0. Anything below 60 was considered to be failing. And across the board, Mr. Ritchie failed all his courses. He failed when he repeated it the second time, and he failed again the third time. So at that point, he basically dropped out of school.
In the course of this these interviews and research that you did you determine information about the environment that Mr. Ritchie was raised in, both as far as family and the neighborhood that he lived in?
Mr. Ritchie grew up in what was considered to be the Garrison area of Jamaica. It was a very violent area. He reported that many of his friends were killed, and that was a daily occurrence. The poverty was great. As a matter of fact, he had himself and his 4 siblings from his mother's side all slept in one bed. They kind of slept in a, I guess, horizontal. But there was tremendous poverty, violence, and it was the hood in a very rough neighborhood.
Did you determine or research how he was raised as far as his relationship with his mother and his father?
So he was the oldest of not only his mother's children, but his father had multiple children from many different women. I think in total there was 18 children in total, and the father was very violent, very abusive, and he received a tremendous amount of blows.
He being Mr. Ritchie?
Mr. Ritchie. He was also held accountable for the other siblings to take care of them, and he basically sustained all that abuse up until about 16. At 16, I guess he was already grown up enough that he basically just left and stopped getting the blows from his father.
And do you know where he went to?
So at 16, when he dropped out of school, he was working full-time at the airport in Jamaica. He was in the food business. He did that for several years. I think at some point he also he built a separate room where he could sleep, but he certainly had more independence at that point than before.
Was this still in Jamaica?
That's correct.
And was there a pattern of gainful employment?
Yes, so he first worked several years at Verse Air, which is a Jamaican airline, but he was in the food business, food catering for the airlines. After that, he worked cell phone towers. He started in Jamaica, working, putting in cell phone, climbing up to the top of the towers. And he did that up until leaving Jamaica, which was about age 26. And then when he came to America, he continued working in cell phone towers.
I know I've asked you about the head injuries. Did you do any other research regarding any head trauma that Mr. Ritchie suffered?
As I mentioned, well, he did have 2 injuries when he was about 10 years old in Jamaica. He had several motor vehicle accidents while he was in Tampa area. There was also an indication where he suffered from some dizziness, headaches. So there's indication that there were some abnormalities across his lifestyle.
Were you able to look at any hospital records from anything of the past?
Yes.
Okay. And were they consistent with what your observations were?
Yes.
Okay. Did What other behavioral observations, if any, have you made of Mr. Ritchie, whether it's depression or anything else?
So Mr. Ritchie was very compliant with all the 32 hours of evaluation. He always did what I asked him to do. Sometimes he was depressed, he was anxious, understandably so, but to the point that he's been receiving medication to treat depression, anxiety, and even he's now on an antipsychotic medication.
You said he was compliant. Did he ever show any aggressive behavior?
Never.
He was cooperative with you?
Yes.
Okay. Did he ever refuse to cooperate with you?
No.
Okay. Now, going back to some of the testing, again, I don't want you to get into each one necessarily, but can you tell the jury if there is any specific conclusions that you've arrived at other than what you've already testified to based on the test that you conducted?
So one other area that I haven't touched upon is attention concentration. Mr. Granville Ritchie has difficulty with sustained attention, sustained ability over a period of time. I gave him several tests. One was a computerized test called the TOVA, which stands for the Test of Variables of Attention. And this is a test that objectively measures impulsivity, adaptability, and his performance was not within the normal limits. There was variability throughout the test. There was inattention. There was impulsivity noted. And this test is used as an adjunct to independently diagnose attention deficit disorder. So it's based on this and based on other tests that I gave him that demonstrated that as the task became more complex, more difficult, that's where there was a greater breakdown in terms of mental functioning. And it seems that he's had attention deficit disorder throughout his life.
In total, how many tests did you conduct?
Probably there's 25, but of those 25, you probably break them down into subtests, and it's probably close to 100.
And were all of the testing and the results of the testing consistent with your ultimate opinions?
Yes.
If I could direct you to the working memory subtests that you conducted, I believe it's on page 6 of your report.
Yes.
There's one test that you indicate that the difference between the two subtests was significant. Could you explain what that test was and why the significance?
So these were two subtests from the Wechsler Adult Intelligence Scale. Digit span, which is just ask the individual to repeat numbers forwards, backwards, or in sequence, he was fine. So if you give him the exact thing to do, he's able to do it. But then on arithmetic, which was asking him problems to solve in his head, so he had to think about, first understand the question, think about what is being asked for him, and then to respond accurately, he was significantly lower. Again, so the more complex the task, the more difficult the task, that's where there's greater mental deterioration.
Now, based on these tests, as well as the information that you had been provided by Mr. Ritchie and the three people that you interviewed, did you believe that there was a need for testing of the brain?
Yes, I did.
And what did you recommend?
So based on the neuropsychological deficits, the executive functioning, the frontal lobe impairment, the attention deficits, the attention deficit disorder that was noted, and again, from multiple tests, never relying just on one single test, but it's the combination of hours of testing, the analysis of all the testing. It was my clinical judgment that Mr. Ritchie did present with neuropsychological deficits, executive functioning deficits, frontal lobe deficits, problems with judgment, impulsivity, decision making, the areas of the brain that one needs to function, and certainly under stressful situations. So therefore, I recommended that they would conduct neurodiagnostic testing, meaning MRI and PET scan of the brain.
Now, although you are qualified to make those recommendations, are you qualified to prescribe that and do the testing?
No, that has to be done by a medical doctor, and so I'm not qualified in terms of either making the referral or certainly reading the results.
So that's why you simply made the recommendation that it be done, correct?
Correct.
Okay. And you have interviewed Mr. Ritchie, or have you interviewed Mr. Ritchie since these tests were conducted?
Yes, I have.
Okay. Based on your 32 hours with Mr. Ritchie, were you able to form an opinion as to the risk of recidivism?
Yes. So I conducted what was called the VRAG, which is the Violence Risk Appraisal Guide. Psychologists have used this instrument with tremendous amount of research that has been conducted, and the idea is to sort out those factors that will correlate with each other in terms of making a determination as to what the risk factor of an individual is given their future likelihood of dangerousness or recidivism. With the group, there was also a statistician who used statistical analysis to see which items match with each other in terms of making a determination as to what factors are important to make this ultimate conclusion. It's actuarial, which means that the data can be extracted even without the individual there. One just has to have some demographic background of the individual, and once you plug in the demographic, then you score it, and then it comes back with based on their level of likelihood to be more, in order to be recidivism or to be likelihood of a future violent episode.
And what was your conclusion based on that test?
So, based on the score of the RAG, there was an 8% probability of violent recidivism within 7 years, meaning that there was a very low likelihood of risk based on the different risk factors that is associated with the test and with Mr. Ritchie in terms of his background, in terms of, again, the likelihood of him being a good candidate for general population.
Does that opinion and that test result indicate that Mr. Ritchie is a good candidate for life imprisonment?
Yes.
With a low risk of dangerousness?
That's correct.
Okay. Now, by the way, you said that you're not a medical doctor. You're not a psychiatrist, correct?
That's correct.
The testing that you do, is it something different than what a psychiatrist does?
Yes.
Explain to the jury.
So a psychiatrist is a medical doctor who goes to medical school and then has a subspecialty in psychiatry. So psychiatry basically deals with serious mental disorders that generally are not always, but most of the time you prescribe different medications to alleviate the different symptomatology. That's a psychiatrist. That's what their training is. Their training is usually inpatient hospital, psychiatric hospitals, those type of settings, and that's the gist of what they do.
Okay. You've talked about the violent, crime-ridden neighborhood that Mr. Ritchie grew up in. Does that does it surprise you that Mr. Ritchie has no prior criminal history?
It's pretty incredible. That's true.
Did you determine when discussing the head injuries with Mr. Ritchie, did he complain of having migraines after he suffered from the very beginning, from the initial injury back as a child?
He mentioned that he does have migraines.
And was that something that you may have asked any of the family members?
Yes.
Okay. Doctor, have you... One second, if I may. Does your neuropsychological examination demonstrate brain damage?
Yes, it does.
Explain to the jury.
So, again, the total scores from all the hours of testing demonstrate that there's executive functioning deficits, meaning, again, there's impairment in terms of frontal lobe ability of judgment, reasoning skills, decision-making abilities. That type of impairment is certainly consistent with brain impairment. But moreover, there's a history of head injuries to explain the fact that there is cognitive brain impairment. Not only that, but he had attention deficit disorder all the way from early on, and that was also another indication of brain impairment. The totality, and of course the academic failing that we have the records for, where it's my contention that no one fails school volitionally. If someone fails school, it's because they're having great difficulty academically. No one wants to be a failure. No one wants to look worse than they are. So the fact that he failed 2 times and his scores were all below 60 is indicative of the fact that he had low academic skills caused by attention deficit and, of course, not focusing and not spending the time necessary to be able to complete academics appropriately. So the combination of all these different factors is my conclusion why he has unequivocal brain damage.
Do you, based on your interviews and research in this case, were you able to determine whether or not Mr. Ritchie was kind and generous to others and possessed other positive redeeming qualities that we have not discussed?
So Mr. Ritchie is really a very reserved, well-spoken individual. He never used, not during the 32 hours, I did not hear once any foul language, never swore once in 32 hours. He was respectful, he was kind, and as a matter of fact, documentation that while he earned money working in the United States on the cell phone towers, he sent back money back to Jamaica. He went back to Jamaica several times to not only to he had suitcases full of different articles that he passed out to individuals that were less fortunate. He at some point he was sponsored as a soccer player, and he would buy school supplies, give them to kids that they couldn't afford school supplies. He used to take meals to elderly people on the holidays. So he demonstrated a certain amount of certainly kindness and respect, and still very much part of the community that he grew up in, and he gave back to the community as much as he possibly could.
And are you aware that even though he's been incarcerated for 5 years, that he's maintained a relationship with his girlfriend, Miss Kelly?
That's correct.
Doctor, within the bounds of reasonable psychological certainty, neuropsychological certainty, do you have an opinion as to whether or not the capacity of Mr. Ritchie to appreciate the criminality of his conduct to the requirements of law was substantially impaired?
Yes.
And you believe it was impaired?
That's correct.
Okay. And within the bounds of reasonable neuropsychological certainty, do you have an opinion as to whether the capital felony was committed while the defendant was under the influence of extreme mental or emotional disturbance?
Yes.
May I have a moment, Your Honor?
Yes.
I don't have any other questions.
Okay, Cross?
Is it possible to take a quick recess?
We can, if you need one. Okay, very good.
Yes.
Take a quick 5-minute comfort break.
That's fine. Perfect.
Okay, sounds good.
Thank you.
Before Cross. But because you, jurors, you go ahead and step out.
Oh, rise jury
Um,
exiting.